provision of healthcare is actually more a provincial kind of, purview. I think the real thing that at the federal level is going to actually be impactful for healthcare is the protection or the reinforcing of the Canada Health Act. Just for viewers that don't know exactly what the Canada Health Act is, basically an act that was signed in order to guarantee that all medically necessary procedures and the provision of healthcare services that were necessary for people were free and accessible for all. So unfortunately, several of the provinces, as we can see in Alberta and in Ontario, had found loopholes on the way that the Canada Health Act is actually written to introduce privatization efforts. Starting with things like surgeries and procedures and the diagnostics like MRIs and CT scans. Labs were already privatized a long time ago, but are also now encroaching into primary care. So in my personal, one of the reasons I became an activist for healthcare is because I lost a family doctor. My entire family lost their family doctor when we moved here to Barrie, but I actually lost my family doctor before that. My family doctor went to work into a private clinic. I wanted to follow her because she has, we had a 10-year relationship, and it was a great, partnership on the provision of my healthcare. And when I contacted the clinic that she had moved to, I realized that it was a private clinic, and in order for me to receive the services from her, a person that I had 10-year relationship with, it would have cost me close to $5,000 a year. So it became very evident that the privatization of services for healthcare was already well underway in Ontario. So the more I look into the problem and the more I learn about it, it became more obvious that nobody was really paying attention to this issue. So that's how I ended up, getting involved with the Ontario Health Coalition and participating with them in many things. They asked me to start a chapter of the Ontario Health Coalition here in the Simcoe County, which I did. And I have been the Simcoe County Health Coalition co-chair and founder for the last almost 3 years already. I can't believe it. It's been really fast. So I understand in this election, we need to protect the way or we need to protect the right to healthcare. That is what is actually at stake at this election, because the only thing that the federal government can actually do in healthcare is reinforce the Canada Health Act to make it not just for the provinces to have to not just follow the letter to the law, but also the spirit of the law, that was to always have accessibility of healthcare services to everybody, to be equitable for everybody. So we need to make that happen, and it can only happen on the federal level, where legislation can actually reinforce and close the loopholes that are actually promoting the privatization of services in Canada, or healthcare services in Canada. So yeah, for me, that is the main issue, and also other related issues are basically the LGBTQ plus rights to healthcare services, which are being attacked in provinces like Manitoba. Sorry, not Manitoba. Manitoba's doing great. Saskatchewan and Alberta, and it will happen in Ontario too. There are some rambles in there, but also the access to reproductive healthcare, access to proper family planning services for contraceptives and to abortion services. Those are the things that are also at stake in this election, because when we look at how the Conservatives are voting as opposed to what they are saying, then we have a disconnect, and we need to also to pay more attention to their actions than to their words. So yeah, that's one of the things that are actually at stake right now. So yeah, those are the three issues. The Canada Health Act, services and recognition to all Canadians equally, including rural and small communities, LGBTQ, 2S plus communities, and access to reproductive healthcare.